is now 8:30. Hey there and good morning. This is the WLBB Community Voice program here on News Talk 1330 FM 106.3. And this morning we are streaming live on the News Talk 1330 WLBB Facebook page. So good morning to those of you tuning in using the Facebook format. We encourage you to post any questions or comments you have for our guest this morning up on that page, and I'll take a look at those. Joel Brock handling the cameras this morning. Matt Skinner is punching the buttons, and I'm your host, Colin Worthington. Today is April the 1st. Not only is it April Fool's Day, it's the first day of baseball season, and I think we're all pretty much excited about that. You know, after a whole year of kind of getting limp baseball last year, we're getting a good full season this year. April Fool's Day. I can't remember the last time I was wondering if anybody actually does that anymore. It's probably more for the kids. I think in the last 5 years I had to give it up just because there were too many lives being threatened and people put in too much danger, and they weren't finding it funny. So I had to give that up. But let's get serious on this morning's program. Heart disease, it's the number one killer of men in the U.S., accounting for 1/4 of all deaths in 2019, according to the Center for Disease Control and Prevention. It affects men of most racial and ethnic groups in the U.S., including African Americans, American Indians or Alaska Natives, Hispanics, and whites. It can also be a silent killer. Half of the men who die suddenly of coronary heart disease had no previous symptoms. Awareness is critical. A cardiologist, Abdullah Khan, MD, is with Tanner Health and vascular specialists, board certified in cardiovascular disease, adult echocardiography, and nuclear cardiography. Dr. Khan was an honors graduate and earned his medical degree from Aga Khan University in Karachi, Pakistan. He completed an internship and residency in internal medicine at Emory University School of Medicine in Atlanta, where he worked as an assistant professor of medicine and stayed on to complete a fellowship in cardiology. In addition to English, he speaks Hindi and Urdu. And he's our guest this morning, and we appreciate having him on. And pretty darn new doctor. Been with Tanner for just about a month, right?
Yes, that's correct. Good morning, everyone.
Yeah, we do appreciate you having on the program to talk about healthcare, heart care this morning, focusing on heart disease. What is heart disease?
So heart disease can include a variety of diseases that affect the heart. The most common one and the one that people generally refer to is coronary artery disease, and that is basically having blockages in the blood vessels of the heart. You know, besides this, there's also heart failure, heart rhythm problems, but generally heart disease refers to the coronary artery disease. And when you think about coronary artery disease, you know, and what these blockages are, these are basically plaques that deposit in the inner lining of the blood vessels, the coronary arteries that supply the heart muscle. And over time, these plaques get bigger and bigger in size. These are deposits of cholesterol. And patients generally don't have symptoms with these blockages until they get big enough. At the same time, sometimes these plaques can just rupture, causing a massive heart attack, and that's usually when patients have symptoms right away.
And you did talk about sometimes there aren't symptoms come up late. What are those symptoms?
Yeah, so symptoms of heart disease, they can vary. The classic symptom would be, someone having left-sided chest pain, is going into the neck, left jaw pain, left arm pain, but you don't have to have that. A lot of times, especially in patients who are diabetic or elderly patients, they can have, even silent heart attacks or just vague symptoms like nausea, fatigue, indigestion, which they may not even think is a heart attack, but those can be obviously very concerning.
You just named about 4 or 5 things that many of us deal with on a daily basis, so I'm going to be thinking about that all day, especially as I'm down in Bratwurst and eating baked beans, potato chips, watching baseball.
So I would say, the difference in those situations would be that, if you're not usually don't have indigestion or heartburn, and that's just one day you're having these symptoms, it's out of the blue, it feels different, don't ignore it.
Who is most at risk for heart disease?
So there are a lot of risk factors for heart disease, one of them being, having diseases that can increase your risk, such as having high blood pressure, high cholesterol, diabetes. So those are the diseases, if you have those, that puts you at higher risk. Then there are things that you do, smoking. If you're a smoker, that increases your risk. If you drink alcohol more than you should be drinking, that increases your risk. Being obese and overweight increases your risk. So having a sedentary lifestyle, you're not very physically active, don't exercise, that's increasing your risk. And then lastly, a family history of heart disease definitely increases your risk. So, if someone in your family, especially men under the age of 65 or under the age of 55 or women under the age of 65, if they had heart disease, that's early heart disease. And if you have a family history of early heart disease, then that increases your risk pretty much.
Well, you think we talk about the history of heart disease in your family. I mean, it's got to start somewhere. So if you don't be too confident, if you have no history in your family. I mean, I don't have history.
So that's not the only risk. So if you
Sure.
if you don't have a family history of heart disease, doesn't mean you won't get it. You also have to look at all the other risk factors that you have. So if you have one or more risk factors, then that alone could be enough to make you develop heart disease.
If somebody does have heart disease and they're the first one in their family, I mean, so that does make their descendants more likely to get heart disease.
Yes.
And is that based on just their lifestyle, or is that just?
So it's a combination. It's a combination of environmental factors and genetic factors. So not so if someone in the family has heart disease, doesn't mean that everyone in the family is going to get heart disease. It just means that an increased risk of if someone's risk was increased by their lifestyle choices, then other family members who make better decisions may decrease the risk of having heart disease.
Okay, as far as lowering our risk for heart disease, I mean, we talk about it all the time. Right? Be healthy. And it's like, well, we don't like to do that. But what are some of the things we can do to lower the risk?
So there are things that the person himself can do, and these would include things in their lifestyle. So if you smoke, quit smoking. If you don't exercise, start exercising. Make sure you have a healthy diet. Eat lots of fruits and vegetables. Cut back on your meat intake, on your carbs intake. That's things that a patient can do himself. But then there are things that you may not know about. So it's very important to see a doctor on a regular basis, because if you have high blood pressure, that needs to be controlled. If you're diabetic and you don't even know about it, it's going to get worse and it's going to increase the risk of having heart disease. Same thing for cholesterol. Nobody feels any different from having a high cholesterol unless you go to the doctor and get that checked. That's how you'll find out, and that's how you can prevent that from causing heart disease. So you want to take action on both ends.
We talked about the symptoms and things that we would know about, and there are symptoms that may not show up. Why would I go to the doctor to get that checked out? Is there an age that you suggest?
So I would say generally my opinion is that anyone, especially once they cross the age of 40, they should see a primary care doctor on a regular basis, period. Because there are things and diseases that can get picked on much earlier if you're going to your doctor. You don't want to wait until you start having symptoms, because that means we kind of lost on this time period where you could have prevented disease. Now you're coming in with already having developed a disease. One of the tests that we perform if someone has risk factors is called a calcium scoring test. It's a CAT scan that looks at the blood vessels of the heart to see if there's any calcium around it, and that calcium is a sign of having plaques in your heart. So if you get a test, if you say you have no symptoms and we think that test is indicated for you based on your risk factors, we get the test, we see that you have a lot of calcium, that means we got to start taking action now. We got to start doing medicines to prevent your disease from progressing to the point where you start having symptoms. We want to prevent you from having heart attacks and strokes and not see you when you have a heart attack and a stroke.
When you see the calcium buildup that you're concerned about, what's the process after that? What are the steps that you're taking? I mean, obviously you're going to change your diet.
Yeah, so besides lifestyle changes, those patients would generally need to be on a baby aspirin. They would need to be on a cholesterol medication, and that's going to prevent their from developing heart disease and stroke and having heart attacks and strokes in the future. So making those changes can help out with that. Also, depending on what we see and depending if they have any symptoms, we may have to do further testing like a stress test to see if there's further intervention needed or not.
You mentioned baby aspirin. What do you think about people doing that on their own, taking that anyway, even if they don't?
So that's no. So if you look at the guidelines, that's not recommended because every medicine, including a baby aspirin, has risk associated with it. So if you do not have risk factors that put you at risk for heart disease and stroke, and then taking an aspirin can just increase your risk of bleeding. So we want to make sure that you only take an aspirin if you need it.
We talked about some of the risk factors for heart disease. Why would diabetes be a risk factor for heart disease?
So diabetes, it increases not just your glucose level, it also causes deposition of cholesterol. It changes your metabolism in many ways, and that kind of increases and accelerates the process of atherosclerosis, which is getting cholesterol deposited in the blood vessels of your entire body, including the heart.
As far as that calcium scoring, how does that work?
So the calcium scoring is basically a CAT scan that looks at the calcium on the blood vessels of your heart. And as I mentioned, when you have plaques, that is deposition of cholesterol in the blood vessels of the heart, that comes along with some calcium in it. And the CAT scan is a powerful tool which it's an X-ray machine, and it looks at how much calcium you have in the blood vessels. And if you have no calcium, that's a very, very good sign that you are at very low risk of developing heart disease, and that's kind of a thumbs up. You're doing really well. Whatever you're doing, keep doing it. But on the other hand, if you have calcium in there, that tells us that you have already started developing heart disease. You may not have any symptoms yet, but you're kind of headed in the direction that's going to get worse over time. And now, since you've caught it at an early stage, we can prevent it from, developing and progressing over time. It's a test that's unfortunately not covered by most insurances. However, we at Tanner, we have a special rate that you can get it done at just $99, and it's gonna, hopefully impact your health and prevent you from getting heart attacks and strokes in the future.
To sign up for something like that, do you call Tanner straight up, or do we call individual doctors?
So you cannot just get a test by yourself. You still need to see a doctor to see if it's truly indicated, because at the end of the day, the doctor can make a decision whether you need a test or not.
Mm-hmm. Okay. Our guest this morning, we're talking about men's heart health. Our guest is Dr. Abdullah Khan, and that's with Tanner Health System. And we're going to take our first break here and continue our conversation. Questions and comments, I encourage you to post those up on the News Talk 1330 WLBB Facebook page, and we'll continue our conversation after this. Community Voice brought to you by Tanner Health System and Oak Mountain Academy on News Talk 1330 FM 106.3.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. Our pre-K 3 through 12th grade environment offers a family-oriented atmosphere. We are an independent school with faith-based values and an academy honor code. Our academic standards prepare our students for college and beyond. I'm Patrick Duran, headmaster, inviting you to visit us on the mountain or at oakmountain.us. Come see how our warriors are creating legacies.
8:41. Welcome back to the WLBB Community Voice program here on News Talk 1330 FM 106.3. And this morning we're on the News Talk 1330 WLBB Facebook page. I'm your host this morning, Colin Worthington. My guest is Dr. Abdullah Khan. He is a cardiologist with Tanner Heart and Vascular Specialists. Our topic this morning, we're talking about men's heart health. Why should we differentiate between men's and women's heart health? Why are we focusing this morning on men's heart health? Is there different risk factors and things to pay attention to?
So, even though heart disease is the number one killer for both men and women, it's the number of men who die from it is far more than women. Mm-hmm. So, and a lot of times I would say men, unfortunately, we tend to take our symptoms lightly. A lot of men, especially the veterans that I've treated at Atlanta VA Medical Center, if they would have symptoms of chest pain, they would just want to kind of push through it and not want to talk about it, feel like they're strong enough to handle it. And those are things that you don't want to do when it comes to heart disease. Men tend to take their symptoms lightly and try to kind of push themselves through it. And that's not what I recommend. So it's important that men kind of think about it and not take their symptoms lightly and get attention when they need it. They are more proactive about seeing a doctor. A lot of guys are, I'll be fine, I'm okay, I've been doing this for whatever number of years and nothing has happened so far, so I can keep living this way. But no, that's not the case. You gotta take action, because you don't want to start taking action once you have problems like a heart attack and a stroke. You want to take actions to never get to that point.
And you mentioned, I think all men were thinking, all right, well, I'll worry about it tomorrow, or I've gotten this far, without anything. It's a problem. So I think that begs the question: how long can you go if you're experiencing some sort of symptom? I mean, realistically, when's it going to be too late? When do you realize, well, I should have gone to the doctor sooner?
So I would say it's never too late until you actually die. That's when it's too late at that point in time. But the correct question would be, when would it be too early? And honestly, it's never really too early. Once you are an adult, you should be seeing a primary care doctor at the least once a year. And I would say once you cross the age of 40, and if you haven't been seeing a doctor, you are not doing wrong thing for yourself. You got to see a doctor. You got to make sure your blood pressure is getting checked, your cholesterol is getting checked. Because those generally won't cause any symptoms. By the time you're having symptoms, you've already had some damage done. As doctors, we can try to prevent further damage. We can try to prevent further bad events from happening, but we cannot reverse all the damage that's already happened. So we want to catch things early. We want to prevent things from progressing. We don't want to see you when you have a heart attack. We want to make sure you don't have the heart attack in the first place.
As somebody who might be going through a heart attack, and they're feeling the pain in their chest and their arms are affected as well. What say you're with somebody, you're at a restaurant, you're at home with your family. Mm-hmm. If I see somebody having a heart attack, how should I respond? What's I guess I don't say my responsibilities, but how can I make sure that they're comfortable and I guess prepared to get to the hospital? Or
so that's an excellent question. And I think what we need to understand is that when you suspect a heart attack, don't try to figure things out on your own. The first thing you got to do is you got to call 911. Okay, as I mentioned, the symptoms of heart attacks can sometimes be vague and non-specific. And if you have any suspicion, don't wait around, call 911 so that the ambulance can get to you right away. You don't necessarily want to drive the patient to the hospital in a car, and that's the reason for that. When you're in an ambulance, the EMS, they can perform an EKG, which is look at your heart rhythm, and that can be sent directly to the hospital, such as Tanner, and the ER doctor would look at the EKG and would tell right away whether or not the patient is having a massive heart attack. If that's going on, we can get our cardiologist right there, so that by the time the patient gets to the hospital, we can get him straight to the cath lab, look at his arteries, and put a stent if needed. And this is important because when it comes to heart disease and heart attack, time is muscle. Every passing second and minute, some of the muscle is going to die. And the earlier you get attention, the better it is. So, if you're not going through an ambulance, you get to the ER directly, you've wasted some time where we could have gotten the cardiologist ready to take you to the cath lab instead of, having them figure out once you get to the ER. So some time lost there. Also, if you don't go through an ambulance, when you're having a heart attack, the risk of having a cardiac arrest, which is when the heart just completely stops. You could go into a dangerous rhythm, the heart is no longer beating, and the person is just dying. If that happens while you're driving, there's nothing, honestly, you can do about it. However, if you're in an ambulance, the EMS, they can shock your heart, they can start performing CPR, and again, save your life. So it's important that you call EMS, you don't wait, and that's the best thing you can do.
Dr. Abdullah Khan, our guest on this morning's Community Voice program, discussing men's heart health. If you do have a heart attack, is there ever, can we pinpoint like a trigger that makes it happen at that point? I mean, I think about, maybe over the holidays we hear about a lot of heart attacks, and I often wonder if that's because they ate too much or ate too much bad stuff, or because they were around family. Wink, wink. But are there more common triggers to make that actually happen, that event where you have that heart attack?
Most of the time, no. Honestly, it just happens to happen at that time. There's no particular trigger. Sometimes stressful events can do that, but honestly, it can just happen out of the blue with no explanation, no real trigger for it.
Mm-hmm. Before we take our final break here, say I decide I want to go get my heart checked out. It's time for me to do that. What's going to be that process once I set up that appointment? What are the things that you're going to be doing in that first appointment, and then I guess before you recommend a second and possibly third appointment, what am I going through? You're going to check my blood pressure? And
so the first step you got to do is you got to call, say if you come to Tanner, call one of our offices. We have offices in Carrollton, Willarica, Wedowee, Bremen. And so call an office, schedule an appointment. You don't need a referral to, we have several cardiologists, and you don't need a referral to come and see us. So come and see us, and once you come to our clinic, we'll talk to you. We'll try to figure out whether you have any symptoms. Sometimes patients don't realize that they've actually cut back on their activity, and because they tend to get a little short of breath, and those are something that we are able to dig out once we start talking to a patient. So a lot of times patients, they have no symptoms, but when I ask them, okay, when was the last time you climbed a flight of stairs? And they're like, oh, it's been a long time. Why don't you do that anymore? Like, yeah, I get a little short of breath when I do that. So things that you may not even think about, because a lot of people just start cutting back on what they do as if realize that they are not able to do it anymore.
Right, yeah.
So the first thing is, I ask questions, try to figure out there's something, that requires further testing from that perspective. And then the other thing is, look at their blood pressure when they come in. If they haven't had any blood tests done, I would at least check a cholesterol. If they haven't ever been screened for diabetes, check for diabetes. So those are the main tests that I would do. And if they have other risk factors that I mentioned, like an early family history, or already have known diabetes, high blood pressure, then I would consider getting a calcium scoring test to see if I need to risk stratify them further. If they don't have any risk factors, then I may not have to do any further testing. But it depends, on what I see. If someone says that sometimes they get chest pain when they walk around, that may prompt me to do a stress test. So it depends on what they're feeling.
Dr. Abdullah Khan, our guest on this morning's Community Voice program. We're talking about men's heart health. We're going to take our final break here. We're going to come out and come back and find out the doctor's favorite baseball team and how much he has enjoyed Carrollton here so far. Got about 10 minutes left in our program. Community Voice brought to you by Tanner Health System and Oak Mountain Academy here on News Talk 1330 FM 106.3.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
It's 8:50. Welcome back to the WLBB Community Voice program here on News Talk 1330 FM 106.3 and streaming live on the News Talk 1330 WLBB Facebook page. I'm your host this morning, Colin Worthington. We are talking about heart disease. It is the #1 killer of men in the U.S., accounting for 1/4 of all deaths in 2019. That, according to the Centers for Disease Control and Prevention. It affects men of most racial and ethnic groups in the U.S., including African Americans, American Indians, or Alaska Natives, Hispanics, and whites. It can also be a silent killer. Half of the men who die suddenly of coronary heart disease had no previous symptoms. Awareness is critical. Our guest this morning is cardiologist Abdullah Khan. He's with Tanner Heart and Vascular Specialists. And the big tease before we went to the break was to check in. It is baseball season. Today's the first day. You're in Braves country, and you did spend some time in Atlanta with Emory.
Yeah, I've been to a couple of Braves games. I wouldn't say I'm a huge fan of baseball per se. I do like cricket. That's the sport that we kind of play back home, and it's actually very similar to baseball.
Yeah.
Honestly.
You able to watch cricket still?
I do watch some, not a whole lot.
You have to stay up after midnight to watch it.
Yeah, because usually the hours aren't that conducive. It's like in a different cricket is happening in different countries, so it's not the same. I wouldn't watch it live when it's happening.
Well, we did watch South Korea baseball. I mean, people that love baseball, we did watch South Korea baseball after midnight, so it was kind of worth it. How about have you just been in Carrollton then for a month?
Yeah, Carrollton, I've been here for a month. I've been in Georgia, Atlanta for almost a decade, though.
Okay. Oh, yeah, but you hadn't been too far west.
No.
Out in Carrollton at this point. Well, I mean, how are you enjoying it? You've been here for a month. I'm trying to think of the weather we've had. It probably hasn't been that great in the last month.
I think it's fine. I think I'm used to the Atlanta weather. It rains a lot. I don't mind rain. I like the fact it's so green here. So I like the weather. I don't mind. And it's not that cold anymore. So.
Well, I think tonight it's going to be 29 degrees.
Yeah, that's true. Yeah, it's going to drop tonight. Yeah.
But it's going to be 80 next Thursday. Yeah. And I think that is the joke about Georgia. Just about that. In 1 week you need all these different clothes and outfits to wear. So it'll warm up by then. Sunshine all the way through that point as well. We are talking about heart disease this morning with our guest, Dr. Abdullah Khan, and Tanner Heart and Vascular Specialists. Where is that located?
So we have offices in 4 locations. We have one in Carrollton, then Villarica, Bremen, and Vidaui.
And is there a website for that to check out information?
Yes, it's heartandvascularspecialist.org, and our contact number if you want to make an appointment is 770-812-9326.
Now, I know people can, when we're finished with this program, we're going to post it up on the Facebook page. It'll still be there. We'll have a podcast on our website at newstalk1330.com. But is there maybe an easier list of things on your website, or do you have, recommend a website for people to go just to check out? Because I mean, I'm checking symptoms or things, every day. If I stub my toe, I'm looking up and finding out the symptoms and for that. And of course, I won't do anything about it because, as you said, we're men, we ignore that. But Is there like a to-do checklist?
Yeah, so if you go to tanner.org/calcium scoring, we actually have a quiz there that goes over the risk factors, and if you have any of those risk factors, then you should prompt a visit to a cardiologist to see if we need to assess you further.
Well, and just recapping the program, go over again some of the not the risk factors, but maybe some of the symptoms. You said you're not always going to have symptoms if you have heart issues, but go ahead and let's go back over some of the symptoms.
Yeah, so
Again, if we're watching baseball today and we're yelling at our team in the first game of the season, and we're eating big hot dogs and pretzels and ice cream and all that stuff just to celebrate baseball, I mean, you're saying that may not cause it today, just to maybe a little upset stomach, and we don't have to take that as serious.
Not.
But what are some of the symptoms that we should pay
So,
attention to?
symptoms like having chest pain, jaw pain, neck pain, pain in your left arm, and I'm talking about pains that don't normally happen to you. If those start happening, that could be a sign of heart disease or heart attack. Also, there are other diseases of the heart that can present kind of more slowly, like, having shortness of breath when you walk around, chest pain when you walk around, swelling in your legs, that can be a sign of heart failure. And then there can be electrical issues of the heart as well. If someone has a lot of palpitations, pounding in their chest, not related to exercise, or, even passing out. If they pass out with no explanation, then that's also concerning. So those are all things that can be due to different diseases of the heart, and if you're having those, be concerned about it. And as I mentioned, unfortunately, sometimes it can be vague and non-specific, especially in elderly and diabetic patients, having just indigestion, nausea, vomiting, extreme fatigue. I mean, if you're having those, that should also get you a little bit concerned.
We talk about just being out of breath. I mean, can that just be a sign of being out of shape, or does being out of shape at 50 mean that you're in trouble anyway?
I mean, being out of shape obviously increases your risk, but if you are climbing a flight of stairs and you're having to stop and rest, that is never normal. Mm-hmm. So that's not just going to be from being out of shape. That's something is wrong with your body. So don't ignore. If you get short of breath when you run like 5 miles, sure, that's going to be normal. But if you're getting short of breath with just one flight of stairs, or we're just walking to the mailbox, or you're getting chest pain with this level of exertion, that is never normal. That needs to be looked into further.
And how about the pain in the arm? Is that you feel that along a muscle, or are you feeling it below the elbow?
So it can vary. It can be pain that's going down all the way from your shoulder to your fingers. It could feel like a numbness. It can vary in the way it feels. But if, say, this pain is coming on, all of a sudden it's not going away, that's concerning. That could be a sign that you're having a heart attack. Or it happens every time you walk or exert yourself to a certain level and you start having this exact left arm numbness or pain. That's a sign that you probably have blockages in the blood vessels of the heart, and that's causing this pain. So, if you hurt your shoulder, obviously that's not going to be the reason for it, for having heart disease, but you have symptoms that come on with exertion, or you're having it just out of the blue and it's not going away, then be concerned.
How does a family member approach another family member and convince them? I mean, because, say you're having these issues, but again, some people just won't check it out. They'll just say, I'll worry about it later. But, I mean, is there a recommendation to how a family member, would approach another family member and say, hey, let's go get this checked out?
So I think the first thing to realize, seeing a doctor is not going to cause disease. So if you see a doctor, that doesn't mean that we are...
But if you don't know it's there, doc, then
and the problem is you don't know if it's there. You might find out later when it's way worse.
Yeah.
You want to, as I said, you don't want to be seen when you have a heart attack. You want to be seen before you have a heart attack and get treated and prevent and never have the heart attack. So, just talking to them like, hey, this is going to help prevent you from having problems in the future. There's no harm from seeing a doctor. The only thing is that they'll figure out there's something wrong and they can potentially prevent it from getting worse over time. So that's a good reason to see a doctor. And as I said, once you cross the age of 40, your body slowly and, but surely, unfortunately, is kind of breaking down over time, whether it's, people getting arthritis over time or, heart disease, body is kind of gradually wearing down. And fortunately, we have modern science with medicines and testing that we can make you live longer than you could, 100 years ago. So we should take advantage of what technology has to offer us.
Does it bum you out when you see people are not doing things to take care of themselves just because they don't have the money or they don't have the proper insurance?
It does hurt me, honestly, but I know at least at Tanner, we see patients without insurance all the time. I worked in Atlanta, and one of the hospitals I worked at during residency and fellowship was Grady Hospital, which is a county hospital. I saw lots of patients who didn't have insurance, and so I understand, the limitations or what we can do. So, that always in my mind about what other medicines I can use which may not be as expensive, and other solutions I can provide. If say, those patients cannot, if they don't have insurance, they don't have money, they cannot join a gym, but there are always solutions. They may not be as good as if you have money and insurance, but there are always solutions for patients who are limited financially.
All right, phone number one more time.
The phone number for our Tanner office is 770-812-9326.
All right, Dr. Abdullah Khan, our guest on this morning's Community Voice program. It was great to meet you, and welcome to Carrollton, and hope you enjoy your stay.
Thank you for having me.
Community Voice brought to you by Tanner Health System and Oak Mountain Academy here on News Talk 1330 FM 106.3. Time right now is 9 o'clock.
And the local stories you care about.